I want to start with a Kaiser Foundation poll because people are so worried about this law. They really don't know what to think. They surveyed folks asking, how will the cost of your health care change? 23% said they thought it would get better. 42% said they thought it would get worse. Dr. P, to you first. What is going to happen to the quality of care? Not just the cost of care, but the quality of care.
The quality of care is already going down. Doctors have less time to spend with patients because they're simply overloaded by the volume. A lot of them are dropping private insurance and just taking people that can pay free for service. And they're having to maneuver and manipulate the system to create tremendous inconveniences just so they're going to get paid. So overall, consumers, I'm shocked at the 23% that you just mentioned, because the bottom line is that we've already seen the quality of care drop for consumers and the access that they're getting to their doctors.
But doctors, of course, are changing what they're doing, right, Dr. P?
Absolutely. They have to. There's no way that doctors can implement electronic medical records, get decreased reimbursements, take on more patients, and still stay in business. So you're seeing in states like Washington where they're having regulatory boards tell doctors what they can and can't get paid for, whether it's a knee replacement or a hip replacement, and doctors are going to conform to that. So you're going to see people getting a lot less than what they're used to getting in the past.
I don't know what upsets people more, the rising cost of health care or the idea that they can't get it. I think maybe the latter. I want to turn now to you, Peter. You're concerned about bureaucracy and waste. You know, there's already a lot of that in the healthcare system. You don't have to go far to find it, but you say this law makes it worse. How?
Well, it creates 159 new bureaucracies, panels, commissions, boards, 159 programs to rule over American health care. And President Obama likes to say this is not a government takeover of health care, but there's, in fact, no aspect of health care that is, no significant aspect of health care that is left outside of government control.
Well, Dr. P, to you, Mitch McConnell had some words about this. I believe it was today or yesterday on a YouTube video. He says the president promised if you like it, you can keep it, meaning your health insurance. But cuts to Medicare Advantage mean millions of seniors will lose access to those programs. How similar is the situation going to be for so many Americans after this law goes into effect completely, which takes a while to go into effect? Their world's really going to be changed, isn't it?
Oh, their lives are going to change completely. You've already seen insurance companies drop Medicare Advantage because they can't sustain it. They put in place the health insurance pools to help people with pre-existing conditions, and only about 13,000 people adopted that. And the cost for people to get insurance who have pre-existing conditions is actually more than they were probably paying before. You're having the states, as you said earlier in that great overview, who more people going into Medicaid. And the number of people that are getting into Medicaid, the states can't afford to pay for that. So what happens? More people end up using the emergency room. We were trying to avoid that in the first place, which means that people can't access the system. So we're even beyond going back to square one. I think we're going to be worse than where we started off from.
All right. Peter, to you, as you look at this system and you think about it, so many companies have opted out of this. They've been able to get waivers. Over 1,000 have been given by the administration. This confuses me even more. So some people are going to have to play by the rules and others aren't.
Those waivers just show what a disaster, developing disaster is in place, because they're getting those waivers because they're documenting that if we have to comply, it's going to raise costs to intractable levels, or thousands of workers are going to lose their health insurance. In fact, once it's fully phased in 2014, soon thereafter, tens of millions of people will lose their employer-provided health insurance, and they'll be dumped into the insurance exchanges.
See, that's my question about it, because I think this incents private employers to not provide insurance at all. Why not just pay the fine instead of paying the full freight of full coverage?
There's already been studies that show that the employers can save enormous amounts of money by just dropping their coverage, paying the fine, and the system basically seems to be set up to get people dependent on government subsidies. This is going to cause the cost of the system to soar, because the CBO assumed that only 19 million people were going to qualify for those exchange subsidies, and that 162 million would continue with employer-provided insurance. Well, if that 19 could easily go to 38, could go to 60, could go to 90, and so the cost of the program will double, triple, quadruple.
The next big entitlement program.
That's right.
That's Obamacare. Peter and Dr. P, thank you for helping us out today. We really appreciate it. Great conversation.